Good morning. Welcome to the May 2020 open meeting of the Federal Communications Commission. Madam Secretary, would you please introduce our agenda this morning?
Thank you, Mr. Chairman. Good morning to you and good morning, Commissioners. For today's meeting, no items will be presented for your consideration. All items listed on the May 6, 2020 Sunshine Notice have been adopted by the Commission and deleted from today's agenda.
Thank you, Madam Secretary. The items for the meeting having been voted, I would now open the floor to any announcements that my colleagues would like to make at this time. Is there anybody among the commissioners who would like to make an announcement?
This is Commissioner Carr. Just for my part, just to say thank you again to all the staff and the tremendous work that they're doing. Really appreciate that. And in particular on the telehealth side, just been very pleased with all the really good work they're doing to move funding out on that front. So that's it for me. Thank you.
Yeah, I would just want to add to Commissioner Carr's sentiments because this is going by so fast. We're doing this in record time. So it's worth pausing to say that we appreciate the staff work that went into the decisions that we made today. And of course, I'm sure that I can speak for all of us and say we appreciate the work that they do every day, especially during this crisis.
Thank you both, Commissioners. Commissioners Starks or O'Reilly?
Yes, similarly, this is a challenging time for all of us, both, at home, with family, with friends, and, being the ability of folks to continue to work and have such high capacity to produce such good work has been something that I've been very proud of the team for. And so thank you for all of your hard work in the midst of the challenges.
Yeah, Mr. Chairman, I join my colleagues in their comments. Thank you.
Well, thanks to all of my colleagues for their sentiments, each of which I fully agree with. And along those lines, with the indulgence of my colleagues, I did want to name the staff who have been working on the items for today's meeting that were voted, because I do think that they deserve recognition, especially under the circumstances in which they've produced such excellent work product. I'll start with the regulatory fees team. From the Office of Managing Director, Tom Buckley, Roland Helvagian, Dina Shetler, Mark Stevens, and Sally Stone. Stephen Dool, David Horowitz, Andrea Kelly, Linda Oliver, Bill Richardson, and Chin Yu from the Office of General Counsel. Jim Bradshaw, David Brown, Mark Colombo, Kevin Harding, Hossein Hashemzadeh, Tom Horan, and Barbara Kreisman from the Media Bureau. Jose Albuquerque, Paul Blaze, Kim Cook, Clay DeSell, Jamie Ann Fuller, Neshe Gundelsberger, Jocelyn Zagirny, Carl Kensinger, David Kresh, Catherine Medley, Carrie Murray, Tom Sullivan, Troy Tanner, and Jay Whaley of the International Bureau. Thanks for the great work on that item. On the 900 megahertz item, which was also, of course, adopted, I want to thank from the Wireless Telecommunications Bureau, Aaron Boone, Boyd Coward, Anna Gentry, Garnet Hanley, Carrie Hicks, Susanna Larson, Roger Knoll, Milton Price, Jessica Quinley, Jacqueline Rosen, Moslem Sawez, Dana Schaefer, Josh Smith, Sean Spivey, Don Stockdale, Cecilia Sulhoff, and Joel Tabenblatt. From the Office of Economics and Analytics, Nick Copeland, Evan Correll, Paul LaFontaine, Catherine Matraves, Julia McHenry, and Gary Michaels. From the Office of Engineering and Technology, Baman Badipur, Michael Ha, Tom Waring, and Aspa Perutsis. From the Office of General Counsel, Mike Carlson, David Horowitz, Tom Johnson, Keith McCrickard, and Bill Richardson. From the Office of Communications Business Opportunities, Shannon Wilkerson. And from the Enforcement Bureau, Ricardo Durham, Matt Gibson, Kevin Pittman, Ron Ramage, and Josh Zeldis. For the Broadcast Notices team item, I would like to thank from the Media Bureau, Michelle Carey, Barbara Kreisman, Sean Mayer, Tom Nessinger, Ariane Rangel, Holly Sauer, Lisa Scanlon, and Al Schuldener. From the International Bureau, Neshe Gundelsberger. And from the Office of General Counsel, David Consul and Royce Sherlock. And last but not least, for the eSIMS team, Jose Albuquerque, Paul Blaze, Jennifer Gilsonen, Cindy Spears, Tom Sullivan, and Troy Tanner from the International Bureau, Ginny Metallo and Marilyn Simon from the Office of Economics and Analytics, Deborah Broderson, David Horowitz, David Consul, and Bill Richardson from the Office of General Counsel, Baman Badipur, Michael Ha, Ira Keltz, Tom Mooring, Nick Oros, and Barbara Pavon from the Office of Engineering and Technology, and Steve Buenzo, Tina Hilfiger, Paul Powell, John Schaubel, and Joel Taubenblatt from the Wireless Telecommunications Bureau. Terrific work by all of the aforementioned folks on the items for today's agenda. Next, I also want to announce with great sadness the departure of the FCC's press secretary, Tina Pelkey. Tina has left the commission to pursue a business opportunity with Blue Origin, and we certainly wish her well. Tina did a fantastic job, both internally working with stakeholders across the bureaus and offices, as well as the advisors in the office of the chairman, as well as externally with a whole bevy of reporters and others looking to gain information about what the commission was proposing to do or had in fact done. And I can't say enough how incredibly organized she was, what a great writer she was, how collegial she was. And at the end of the day, though, what I'll certainly remember with her is just her incredibly positive outlook on life, her being such a good friend to everybody. And certainly the aphorism that's often used, if you don't get along with that person, something's wrong with you. That certainly applies to Tina in spades. So Tina, thank you so much for everything you've done for us, for the commission, and we wish you well in the time to come. Also want to thank, in particular, the FCC staff who've been working on some of the administrative issues relating to the current situation, in particular the Chief of Staff, Matthew Berry, who's done a fantastic job keeping employees informed at every step of the way about certain issues, as well as the Office of Managing Director, led, of course, by Mark Stevens. This has been a tough time for a lot of Commission employees, but Matthew and OMD have done a terrific job of helping employees get the resources they need and the counsel they need about certain administrative policies. Last, I'm pleased to announce that our Wireline Competition Bureau today approved an additional 33 funding applications for the COVID-19 telehealth program, which was mentioned earlier. Healthcare providers in both urban and rural areas of the country will use this funding to provide telehealth services during the coronavirus pandemic. To date, the FCC's COVID-19 telehealth program, which was, of course, authorized by the CARES Act, has funded 82 healthcare providers in 30 states. And these are the healthcare providers that were awarded funding this morning. Starting with Be Busy Wellness Center in Houston, Texas, it was awarded $182,854 to purchase video monitors and connected devices to provide primary and preventive medical services, including remote monitoring, diagnosis, and treatment to COVID-19 vulnerable populations in Houston and surrounding areas. Next, Behavioral Health Services North in Plattsburgh, New York, was awarded $39,181 for connected devices, monitors, and software licenses to provide therapy, medication management, health monitoring, and rehabilitation services via remote patient monitoring and telehealth to patients at risk for COVID-19. Bethesda Community Clinic in Canton, Georgia, was awarded $5,886 for connected devices and telecommunications services to use telemedicine to assess patient health, provide full-service office visits with professional providers, refill prescriptions, and determine if a patient requires COVID-19 testing. Next, the Chicago Family Health Center in Chicago, Illinois, was awarded $292,000 to implement a telemedicine telehealth platform to treat patients without COVID-19 symptoms or conditions, which will improve patient flow, decrease cycle time, decrease financial costs, and free up staff time, enabling resources to be devoted to patients that need a face-to-face visit while reducing the risk of exposure to coronavirus for all patients. Next, Cincinnati Children's Hospital in Cincinnati, Ohio, has been awarded $719,098 to provide telehealth services to the highest-risk pediatric patients with complex healthcare needs, including tracheostomy and ventilator dependence and gastronomy and tube feeding dependence, to limit their potential exposure to COVID-19 by keeping them out of the hospital and safely at home, which, of course, improves their health prognosis and frees up resources to care for children with COVID-19. Next, Community Healing Centers in Kalamazoo, Michigan, was awarded $36,673 for connected devices to assist with substance abuse and mental health treatment using remote video sessions for children and adults staying at home during the pandemic. Community Service Incorporated in Morrilton, Arkansas, was awarded $44,949 for laptop computers, connected devices, telehealth kiosks, and other equipment to use for remote treatment of its youth patient population or for distant office visits during the coronavirus pandemic. Community teaching homes in Toledo, Ohio, was awarded $20,761 to provide for the full continuum of behavioral health services through telehealth connections to COVID-19, highly vulnerable and at-risk children and families, with a focus on youth involved with the child welfare, juvenile justice, and developmental disability systems. Council for Jewish Elderly in Chicago, Illinois, was awarded $6,783 to provide telehealth services in its skilled nursing facility and outpatient counseling departments for over 350 older adults to limit in-person care as much as possible to prevent the spread of the disease. Fort County Mental Health Center in Independence, Kansas, was awarded $16,129 for connected devices to provide telehealth services during the pandemic for outpatient mental health therapy, substance abuse disorder therapy, psychiatric rehabilitation, and other telehealth services. Next, Franklin County Memorial Hospital in Meadville, Mississippi, was awarded $262,934 for telemedicine carts, servers, and additional equipment to remotely diagnose, treat, and monitor patients who are unable to receive care on site as a result of the COVID-19 pandemic. Next, Genesis Prime Care in Marshall, Texas, with 7 sites throughout rural Northeast Texas, was awarded $990,716 to provide comprehensive primary health care, pediatric care, and behavioral health services through video and voice telehealth consults, and internet-connected remote patient monitoring and treatment to serve low-income and underserved patients. Next, Grace Medical Home in Orlando, Florida, was awarded $34,732 for connected devices and telecommunications services to expand the use of telehealth services for medical care to low-income, uninsured patients during the COVID-19 pandemic. Next, Greater Elgin Family Care Center in Elgin, Illinois, was awarded $39,639 for the purchase of laptops to expand its capacity to provide virtual visits for a wide variety of medical services to limit the spread of COVID-19. Next, Helio Health in Syracuse, New York, was awarded $504,034 for laptops, tablets, and other telehealth equipment to conduct remote monitoring and treatment of patients with COVID-19, as well as voice and video consultations, to ensure continued care for the patient population while protecting the healthcare workforce. Next, Heritage Clinic and Community Assistance Program for Seniors in Pasadena, California, was awarded $41,457 to use telehealth services and devices to treat older adults in Los Angeles County with mental health issues who are underserved and often low income, many of whom are homeless and especially vulnerable during the pandemic. Next, Hope House Outpatient Clinic in Albany, New York, was awarded $8,586 to purchase computer equipment to treat patients with substance abuse disorders while maintaining social distancing during the COVID-19 pandemic. Impact Family Counseling is next in Birmingham, Alabama. It was awarded $75,000 for connected devices to provide telehealth and video health services to treat mental health disorders during the pandemic. Next, Intermountain Healthcare in Murray, Utah, was awarded $772,680 to provide remote visits and consultations to patients in Utah, Idaho, Wyoming, Montana, Arizona, and Nevada to reduce potential exposure to COVID patients in facilities, free up hospital and clinic spaces for treatment of COVID-19 related patients, and reduce the potential transmission of COVID-19 to healthcare providers from patients who are asymptomatic but infected. Next, the Jewish Family and Children's Services in Tucson, Arizona, was awarded $27,320 to provide mental health and telehealth services to individuals suffering from significant forms of mental health disorders, including at-risk low income, older adults, and individuals with disabilities, to prevent social isolation, depression, anxiety, and other stress due to COVID-19. Next, Jewish Family Service of the Desert in Palm Springs, California, was awarded $19,636 to provide mental health telehealth services and counseling sessions to address symptoms of mental health disorders and reduce the mental health challenges caused by the COVID-19 pandemic. Next, Mattapan Community Health Center in Mattapan, Massachusetts, was awarded $755,468 for connected home monitoring devices and other equipment to enable the provision of remote medical services for patients with chronic conditions and for the monitoring of patients who have tested positive for COVID-19 and are able to self-isolate at home. Next, OLV Human Services in Lackawanna, New York, was awarded $174,840 to support the cost of connected devices and telemedicine solutions used to remotely treat COVID-19 vulnerable populations using video telehealth applications throughout Erie and Niagara counties. Next, Reliance Health in Norwich, Connecticut was awarded $18,601 for telehealth services and devices to continue contact with individuals who have chronic and persistent mental health diagnoses and are at high risk for the COVID-19 disease. Next, River Edge Behavioral Health in Macon, Georgia, was awarded $735,365 for telehealth services to care for the most clinically and financially challenged individuals with behavioral health conditions or developmental disabilities, including mental illnesses, substance use disorders, co-occurring behavioral health disorders, and autism, thereby freeing up funds that would have been used to cover telehealth costs to serve individuals with COVID-19. Next, Salina Family Healthcare Center in Salina, Kansas, was awarded $14,418 for laptops, web cameras, monitors, and other equipment to provide video and voice consultations for medical, dental, behavioral health, and clinical pharmacy patients, freeing up physical space and staff to take care of patients with COVID-19 requiring face-to-face appointments. Next, Southeast Alabama Rural Health Associates in Troy, Alabama, was awarded $732,827 to expand telehealth services across its 10 community health centers, providing video and voice consults and remote treatment to its patient population for ongoing primary health services and COVID-19 screening, testing, and treatment. Next, Southwest General Health Center in Middleburg Heights, Ohio, was awarded $190,150 for connected devices, laptops, and other equipment that will be used to conduct remote patient monitoring, medical voice and video consultations, and inpatient care to prevent the spread of COVID-19. Next, Tanner Medical Center in Carrollton, Georgia, with multiple sites in West Georgia and East Alabama, was awarded $879,520 to implement new telehealth services and expand existing telehealth services to treat inpatients and to provide remote services to patients needing treatment for chronic conditions, behavioral health services, and other medical conditions, including COVID-19, high-risk, vulnerable, underserved, and low-income patients. Next, the Transition House in St. Cloud, Florida, was awarded $106,625 to purchase computers, tablets, and other equipment to help remotely treat patients with substance abuse and mental health problems during the COVID-19 crisis. Next, Via Care Community Health Center, a federally qualified health center in Los Angeles, California, was awarded $157,123 to implement telehealth services to conduct video visits to serve its low-income and COVID-19 vulnerable population. Next, Wirt County Health Services Association in Elizabeth, West Virginia, was awarded $274,432 to provide health services remotely, including primary care, behavioral health, and dental services to COVID-19 positive patients in Wirt and Jackson counties, West Virginia, and Meigs County, Ohio, to minimize the spread of the virus and to prevent high-risk and vulnerable patients from contracting the virus. Last but not least, Yakima Neighborhood Health Services in Yakima, Washington, was awarded $177,945 to provide video telehealth services and remote patient consults to its low-income patient population during the COVID-19 pandemic. Now, I want to express my great appreciation for all of the applicants who applied. As you can hear, it's an incredible diversity in terms of geography, functions for which they are seeking funding, as well as the diverse populations they are seeking to treat. And so we certainly look forward to then using this funding to deliver better healthcare outcomes for those who have and those who do not currently have COVID-19 related symptoms. I also want to thank my colleagues on the Commission for supporting the telehealth program, the COVID-19 telehealth program. All 5 commissioners are unified in our support for the power of telehealth, no more so than during the pandemic. And most importantly, I want to thank the incredible staff who, within the Wireline Competition Bureau, who've worked so hard in processing literally hundreds of applications, working with the applicants, going through the data, and making these awards. And in particular, I want to thank the chief of the Wireline Competition Bureau, Chris Monteith, Trent Harkrader, Rashawn Duvall, Ryan Palmer, Christian Huffley, Haley Steffen, Regina Brown, Allison Baker. Folks, you have done an incredible amount of work sorting through a lot of information in a very short period of time not to mention setting up the program in the first place using newly granted statutory authority. And I can tell you, I hear it all the time from healthcare providers across the country, your work is making a real difference. So keep up the great work. We really are grateful for everything you've done. If my colleagues don't have any further announcements, Madam Secretary, could you please announce the date of the next FCC agenda meeting?
The next agenda meeting of the Federal Communications Commission is Tuesday, June 9th, 2020.
Thank you, Madam Secretary. Until then, we stand adjourned. Stay safe, everybody.